Good morning. Welcome to the Department of Family and Support Services Senior Food Box Services RFP webinar. Just a few housekeeping rules. Due to the volume of participants, everyone has been placed on mute. Please submit questions via the questions box and we'll respond to questions at the midpoint and end of the presentation. Please make use of the questions box to notify us of any technical issues. Please be advised that this webinar is being recorded. And anything stated at this webinar is not intended to change the solicitation document. Any changes will be in writing in the form of an addendum issued by DFSS. And the purpose of this webinar is to provide information for the solicitation. A copy of the recording will be posted to the DFSS YouTube channel with the link to the recording under the alerts and or finding opportunity tabs on the website. Please give it up to 5 business days to upload. DFSS retains the right to share a list of registrants to this webinar along with their contact and organizational information at our discretion. Once we introduce everyone, we're going to go through the purpose and the background of the RFP, as well as information about the scope and program description, the selection criteria, timeline, technical assistance for applicants and e-procurement, and then one last round for questions. At this time, we're going to open the floor for our senior division to introduce themselves.
Good morning, everyone. My name is Stacy Subita. I am a supervisor here at the Department of Family Support Services in our Senior Services Division. Thank you for joining us.
Good morning, everyone. My name is Veronica Whitby-Cozy, and I'm a community living specialist here in the Senior Service Division. Welcome.
And welcome, everyone. My name is Julian Black. I am the Procurement Proposal Coordinator. And now that we have that out of the way, we're going to delve into the RFP, starting with our mission.
So our mission is to working with community partners, we connect Chicago residents and families to resources that build stability, support their well-being, and empower them to thrive. Our priorities: deliver and support high quality, innovative, and comprehensive services that empower clients to thrive. Collaborate with community partners, sister agencies, and public officials on programs and policies that improve Chicagoans' lives and advance systemic change. Inform the public of resources available to them through DFSS and its community partners. Steward DFSS resources responsibility and effectively. Next slide. So we do have 7 divisions under DFSS, which include Children's Services, Division on Domestic and Gender-Based Violence, Homeless Services, Human Services. Our Senior Services, as you can see, is highlighted in yellow, Workforce Services, and Youth Services. Next slide. So the purpose of the RFP, the Senior Food Box Program RFP seeks proposals from qualified food service providers who have experience providing monthly delivery of fresh produce, pantry staples, plant-based food, and frozen meat options for older adults aged 60 years of age or older. DFSS seeks to provide services citywide to 6 regional senior centers. Clients may receive a monthly or quarterly distribution of senior food box, and target outcomes will include an overall self-reported decrease in food insecurity. So, the background, the Senior Service Division is also designated as the local area on aging, AAA for the city of Chicago. As the AAA, DFSS coordinates and funds services for older adults, prioritizing those in greatest economic and social need, those who live alone, and those at risk of institutional placement. Working in collaboration with aging network partners, the Senior Services Division efforts are guided by supporting older persons to live independently in their own communities and homes for as long as possible, ensuring those who reside in institutions are treated with dignity and care, and guaranteeing that older persons have access to accurate information to participate in public policy. Together with our service partners, we provide vital information and assistance, congregate and home delivered meal services, senior centers, fitness classes, caregiver support services, in home services, employment training and volunteer opportunities, elder rights program, health promotion and access to benefits. We continually innovate and advocate for our residents so that they may continue to thrive as they age in place. We value the integrity and respect as well as promoting social engagement among the elderly as an antidote to the dependence, social isolation, and withdrawal. For more information on the DFSS strategic framework, you visit www.cityofchicago.org/FSS. Our background continued. The program is funded by the Title 3B of the Older Americans Act, Federal Title 3B. The Senior Food Box program will serve clients who may be experiencing food insecurity. An estimated 1 in 6 Chicago residents is food insecure, experiencing reduced quality, variety, or desirability of the diet, and the possibility of reduced food intake. The City of Chicago is committed to improving the health of all of its residents and to promote safe, healthy, and fair work environments for its workforce. It is recognized that the significant buying power of public institutions across the country can reform the food system. In 2017, the City of Chicago adopted a resolution for the implementation of good food purchasing standards. The purpose of this policy is to make good food defined as good food that is healthy, affordable, fair, and sustainable, more widely available to all communities in order to promote healthier eating habits, invest in local needs, racially equitable economy, and create more living wage jobs among the food supply chain. The good food purchasing standards emphasize 5 values: local economies, environmental sustainability, valued workforce, animal welfare, and nutrition. The goals of the Senior Food Box program are to reduce the food insecurity by increasing access to nutritious food for older adults, by providing delivery of fresh produce and frozen meats, provide a variety of ingredients options for those who enjoy cooking, strengthen the ability of the older adults to come and to remain or provide care at home. Current state and proprieties of improvement. In 2024, DFSS served 3,402 clients, 31% in-home delivery clients, and 69% at senior centers, and 12,596 units. Of the 12,596 units, 3,897 units were serviced monthly at the senior centers, and 8,699 units delivered monthly to the home. In the previous contract, the program was funded by the American Rescue Plan ARPA funding. DFSS intends to utilize Older Americans Act funding to implement the Senior Food Box Program to serve older adult clients who may be experiencing challenges with access to health food, as well as with food insecurity. An estimated 1 in 6 Chicagoans residents is food insecure and experiencing a reduced quality, variety, or desirability of diet and the possibility of reduced food intake. And this is according to the Chicago Food Equity Agenda 2021. According to the State of Senior Hunger in America in 2021, 5.5 million adults aged 60 or over in the U.S. after food insecurity. Among older adults living in the Chicago area, 7.5% are considered food insecure and 3.3% very low food insecure. For 2025, food prices are predicted to increase by 3.2%, which will result in a greater need for food support for older adults with limited income, according to the USDA 2025. Among older adults who live below the poverty level, 32.1% are considered food insecure. And this is taken from Feeding America 2021. Next slide. Our targeted population. Eligible clients include older adults aged 60 years of age or older. Clients must be prioritized based on the Older Americans Act Title III priorities, which include preference for older adults with the greatest economic or social need, older adults in low income, minority communities, and older adults residing in traditionally underserved communities with limited English proficiency. Inclusion of residents from local communities in planning, cultural adaptations, and/or improvements to the senior food box program is encouraged. The selected respondent must apply this preference during intake and service delivery, as well as to any outreach activities to ensure priority is given to the targeted population. DFSS will work collaboratively with respondents, providing assistance and support to help identify priority populations. Next slide. Program requirements. The Senior Food Box Program RFP seeks organizations that have the following overall experience and capacity to meet the required activities: providing food services throughout Chicago to ensure equitable access to all older adults, implementing the program citywide and delivering services to targeted communities with a higher percentage of older adults in poverty. This may be subject to change. Procuring and distributing all types of food products, including fruits and vegetables, meeting the needs of the population served by DFSS, including the ability to address nutritional needs and dietary constraints due to age, allergies, or medical conditions, veganism and vegetarianism, kosher, halal, and other religion-inspired dietary and cooking practices at food pantries. Promoting and sharing resources and provide clients with referral information to other DFS services, including senior services and other relevant resources such as pantries, soup kitchens, and other programs to access food. Our program requirements continued: distributing monthly or quarterly deliveries to the clients. The selected respondent may coordinate the delivery process, hiring and training of staff, volunteers, in-kind and third-party contractors, and demonstrate a capacity and/or willingness to implement strategies to address any issues related to staffing and/or volunteer retention. Conducting survey with clients to secure feedback and/or input to be incorporated into the service delivery program model. The selected respondent will be responsible for the program management, including outreach, program implementation, retention, and data collection on the impact of the program on clients served. Overall, the selected respondent should aim to serve a total of 600 to 1,000 clients annually. DFSS reserves the ability to add and/or change services as needed deemed appropriate to meet the needs of eligible clients. Our outreach. The selected respondent may conduct outreach and identify, recruit, and retain clients in the program. A thorough outreach program is required to identify eligible clients for the program. Respondents are expected to consider how outreach methods and implementation might be adopted to different target populations. Outreach should target caregivers or older adults living independently, in faith-based communities, homemaker agencies, and medical/health providers. Efforts may include, but are not limited to, community presentations, informational brochures, flyers, in-person or virtual webinars, radio, local newspapers, or social media. Program promotion through the various news and public information media is subject to approval by DFSS Public Information Officer, Senior Services, and must credit DFSS and/or funder as a source of funds supporting senior food box program services. Potential partners for outreach efforts and in-person programs locations might include libraries, senior centers, and faith-based organizations. A combination of paid staff, subcontractor, in-kind, and volunteers will be needed to reach as many Chicagoans as possible. For our intake, DFSS Information and Assistance, INA, is the lead contact to receive the intake and referral caregivers to the selected respondent. The selected respondent may take direct referrals, however, the referral should be forwarded to DFSS INA. The respondent at minimum should be available to accept referrals during DFSS working hours, 8:30 a.m. to 4:30 p.m., Monday through Friday, every week of the year except the different holidays, which include New Year's Day, Martin Luther King Day, President's Day, Lincoln's birthday, Pulaski Day, Memorial Day, Juneteenth, Independence Day, Labor Day, Columbus Day, Veterans Day, Thanksgiving, and Christmas. Referrals can be made to INA by calling 311 or 312-744-4016. We also have our aging email at aging@cityofchicago.org. The different food types. The frozen meat option includes various items such as chicken, ground beef, or fish fillets. The vegetarian option will be an enhanced version of fresh produce based on seasonality, including such items as apples, onions, or collard greens. The vegan option may include plant-based foods. Seasonally inspired and culturally diverse food choices should be offered. Alternative food options can be specified with DFSS approval. Delivery specifications. So under a frequency, food boxes will be delivered to regional senior centers clients at least quarterly. Below we have the regional senior center locations. Our Northwest Regional Senior Center is located at 3160 North Milwaukee Avenue. The Northeast Regional Senior Center location is 2019 West Lawrence Avenue. Central West Regional Senior Center is located 2102 West Ogden. Our Renaissance Regional Senior Center location is 78 East Washington, and Southwest Regional Senior Center is 6117 South Kedzie. Our Southeast Regional Senior Center location is 1767 East 79th Street. Delivery requirements, we're continuing with this. Food box deliveries to the senior centers and other settings will be made between the hours of 8:30 a.m. and 2 o'clock p.m., Monday through Friday, and this may include weekends as necessary to meet the enrollment demands of the program. All food boxes must be delivered into the senior centers or designated settings. Food boxes must be delivered in person and directly to the senior center staff. The selected respondent must utilize an automated system for delivery tracking and confirmation technology to allow for verification of deliveries made. Safety standards. Our safety food standards to ensure better quality and control and compliance to food safety standards. Food boxes must be delivered directly from the selected respondent's facility to the senior center or other locations as determined by DFSS. The selected respondent must maintain a proper temperature control of food box items in accordance with the food safety guidelines. Food should be transported and held in a manner that protects the food from contamination and complies with the applicable City of Chicago municipal code and rules. The selected respondent must submit a delivery plan for approval by DFSS within 2 weeks of the notification of contract award. Next slide. Delivery failures. In the event that deliveries cannot be made, the selected respondent must notify DFSS within 48 hours in advance. The selected respondent may call DFSS, but it is required they submit a written notification to DFSS, which includes the reason why the deliveries cannot be made and when the deliveries will be resumed. Drivers must make every possible effort to deliver the food boxes to the senior center locations. The selected respondent must provide two-way communication devices, such as two-way radios or cell phones, for driver communication to the agency's home base. The selected respondent will immediately dispatch another driver vehicle within 1/2 hour of the notification. With appropriate notification, DFSS may allow extra time for deliveries. Notifications to DFSS. These include time the vehicle went down, the specific geographic delivery route that's impacted, boundaries of the route in terms as senior center could be impacted, when the geographical delivery route will be resumed. Excess food. The selected respondent must provide viable alternative options for storage of surplus food in the event of unsuccessful deliveries. This may include, but it's not limited to, donation of food to a pantry, returning the items to the storage warehouse, or emergency deliveries. The selected respondent must provide the policy and criteria for determining the acceptability of donated foods for the use in the program. The selected respondent must be willing to deliver donations from charitable organizations such as gift baskets for the holidays or donated pet food to pet owners enrolled in the food box program. The selected respondent will deliver the items along with the meal delivery at no additional cost to DFSS. For requirements continue for facility requirements, maintain a staff of qualified food handlers at the main facility site, maintain and monitor facilities to maintain City of Chicago and federal sanitation standards. Minimum requirements include 2 staff members or volunteers to manage and operate the food program, 2 people with food sanitation certificates, pest-proof containers with tight-fitting lids to store dry foods such as rice, cereal, and beans, refrigeration shelving, reliable phone number and email address. Next slide. Also, facility requirements is to maintain an adequate labor force to perform necessary tasks. For example, truck drivers for food delivery, food packagers, and inventory control staff. DFSS may conduct annual site visits as the respondent's facility to ensure the sanitation storage of food for distribution. Selected respondents must provide post-written pest control plan and contract with professional exterminators. Next slide. Units of service. The unit of service is one delivery per participant with a cap of one delivery per month. In instances where clients may need to exceed the monthly or quarter delivery, it will require approval of the DFSS program manager and funding availability. Travel, paperwork, planning, administrative duties should be included in the unit rate reimbursement. Emergency contingency plan. And I'm going to, at this point, turn it over to Stacy Sabita.
Thank you so much, Veronica.
Mhm.
So moving on, we're going to be talking about our emergency contingency planning. We do ask that delegate agencies be able to provide contingency plans in case of any type of emergency that could require a change in service delivery. This can include, but is not limited to, cases, for example, during the pandemic, other public health crises, any weather emergencies such as winter storms, tornadoes, heat waves. We ask that policies and procedures must be in accordance to any public health entity such as the Centers for Disease Control, Illinois Department of Public Health, and the Federal Emergency Management Guidance. Emergency plans should be submitted in writing or electronically to DFSS. The selected respondent should notify us within 24 hours should your emergency plan go into effect, and there must be a backup plan for emergencies and other conditions that could prevent the scheduled deliveries of food boxes. Respondents must be able to demonstrate the backup plan in a case of equipment failure. If equipment failures result in the food boxes being unserved, and the plan must include how food boxes will be replaced or delivered in the same day. The selected respondent must keep a moderate surplus readily usable to supply in the program in the event that they do not deliver the correct number of food boxes or in the event that the backup plan is invoked. Next slide, please. Staff qualifications and requirements. The respondent is required to assign and maintain the duration of the services a staff of personnel that is qualified to perform the services. They will have to retain and make available to the city, state, and federal agencies governing funds provided under this agreement proof of certification or expertise, including but not limited to licenses, resumes, or job descriptions. The funds are expected to cover at least one program coordinator and at minimum 3 drivers dedicated to the success of the program. It is allowable for employees to have other roles within their organization as appropriate, as long as it does not impede on their dedicated time to the Senior Food Box program. Other roles are expected to be complementary to this program. Next slide, please. So this is a description of the two positions we just described. So the program coordinator, who would be the main contact to DFSS and manage program operations. The agency must identify a project director for the day-to-day management and administrative functions of the program who possess a minimum of 3 years and demonstrates management and supervisory experience. The program coordinator is responsible for supervising program staff, delivery drivers, and volunteers, and have overall accountability for the service delivery. They should have knowledge, skills, and abilities to dispatch delivery drivers, plan geographic routes, and conduct community outreach. And this position may not be vacant at any time during the contract period. It is preferred that the staff have at least 2 years related experience. As for the delivery drivers, we ask that you identify at least 3 delivery drivers to provide services. They must have appropriate driver's licenses, insurance, and a clean driving record. And drivers must be assigned to routes in a manner that maintains consistency for clients. The use of Lyft or Uber drivers to deliver food boxes is not allowed. Background checks must also be performed on all staff who interact with clients of DFSS, including any assistants, whether employed directly by us or by the delegate agency or subcontracted. All staff interacting with clients must also have at all times proper identification that can be clearly visible by the client. Program staff should be familiar with public health regulations as well as the needs of older vulnerable adults. And the selected respondents must have a form of ongoing comprehensive training for the drivers involved, and include staff in appropriate orientation and training programs when made available by DFSS. Next slide, please. So the background check requirements for our program, we comply with all state, federal, and local laws, ordinances, policies, procedures, regulations, rules, and requirements, as well as executive orders relating to background checks and fingerprinting in order to ensure the safety of our clients. In connection with the services, the selected respondent cannot permit any adult, whether it's someone on your staff or otherwise, to be involved with the services or have direct contact with seniors if any applicable legal requirements would prohibit them from having such involvement or contact. Background checks are also an allowable cost on your budget that would be submitted to DFSS and an allowable expense by the grantor. So any adults 18 years of age or older, whether they are staff, volunteers, consultants, subcontractors, etc., would have to agree to complete a background check. Delegate agencies would be required to administer the following types of background checks: a fingerprint criminal background check that searches both FBI and state databases, a search of the Illinois Sex Offender Registry, as well as a search of the Adult Protective Services Registry if delivering services to a senior's home. In addition to having records of completed checks available during the monitoring site visits, delegate agencies should also have written policies on background checks that include an appeal process for individuals who dispute findings of their background checks, a policy to address commingling of services if your service location includes programming for seniors or children, a policy on conditional employment while an employee waits results of their background check, and a list of offenses that will disqualify a candidate from being hired or volunteering. Failure to produce evidence of a background check completion may result in default and possible termination of the agreement with DFSS. Delegate agencies also have an affirmative duty to timely report any type of incidents to DFSS. Next slide, please. As an Older Americans Act service, the selected respondent may not charge for any services provided under this grant. However, pursuant to the Older Americans Act, all clients could be provided the opportunity to contribute or donate to the cost of their services. Contributions are strictly voluntary, and no client will be refused services for not contributing. Donations are used to expand the services. All project income must be expended within the fiscal year in which it was earned, and all donations must be used to expand the services. The amount of client contributions collected could be deducted from the monthly invoice submitted to DFSS, and suggested contributions can range from $2 to $15 per service unit. The selected respondent is encouraged to collect project income or client contributions to help defray project costs when appropriate, and it must be expended with any changes of expenditures to be approved by DFSS. Excess project income must expand services of the provider under this part and supplement funds received under the Older Americans Act. Next slide, please. So we're going to review our performance measures. So in order to track progress towards achieving the outcome goals of this program and to assess success, we will be monitoring a set of performance measures that include but are not limited to 80% of clients surveyed indicating that nutritional needs have been met by participating in the program, 80% of clients surveyed indicating that the food box program has provided them consumer choice and allowed them to continue cooking at home. 80% of older adults and their caregivers indicating that the food box has strengthened their ability to remain at home. And 80% of clients surveyed indicate overall satisfaction with the services provided. Next slide, please. And then in order to recognize and monitor our progress towards the performance indicators, we are also intending to track the number of older adults. So we are looking at serving between 600 to 1,000 clients and 2,500 to 4,000 food box annually. The number of people served according to race, gender, and ethnicity, and then the units of service, which is 1 delivery per client with a cap of 1 delivery per month. In addition to the performance indicators and output metrics listed above, we also encourage respondents to propose additional indicators and metrics, including those that demonstrate success. DFSS does serve the right at any time to visit the respondent or subcontractor agencies to monitor quality assurance. Next slide, please. As part of contract management and data and our commitment to become more outcomes oriented, we do seek to actively and regularly collaborate for periodic meetings with the delegate agencies. We reserve the right to request and collect other key data and metrics from delegate agencies, including client level demographic, performance, and service data, and set expectations for collaboration. Upon contract award, delegate agencies will be expected to collect and report client demographic data, service data in the contract, and we use the Aging IS platform to track and report. It is the expectation of the selected respondent to assist with collecting client information as we report monthly, and requirements may change as directed by the funders. Delegate agencies must implement policies and procedures as well to ensure privacy and confidentiality of client records for both electronic and paper files. Next slide, please. Selected respondent must maintain a file for the client that is secure and locked. They must ensure that the information is accurate, complete, and maintained separately from other files, and that they can select to keep files electronically. Again, policies and procedures to ensure privacy and confidentiality. There must also be a mechanism for filing complaints or grievances regarding the service delivery. So clients must also be able to make comments and suggestions on service delivery improvements. DFSS just reserves the right to create such a mechanism, and a complaint log may be kept recording the name of the client, date of reason, or for dissatisfaction. Finally, we also have program evaluation and satisfaction surveys. The selected respondent should have procedures for evaluating and reporting the satisfaction for delivery of service, as well as their satisfaction for the outcomes of the service. They may be asked to administer a survey measuring any satisfaction developed and report the results of the survey to offer feedback, at least on a quarterly basis. Next slide, please. The selected respondent must also use a computerized client tracking system and report by the 5th of the following month. The respondent will keep track of the units of service provided, unduplicated counts of persons served, and other demographic data needed. And both program and financial reports are required of all funded providers. We require that providers have program and fiscal reporting system that will ensure accurate and timely reporting, and reports must be submitted on time to allow to prepare for our own reports and to reimburse service providers. Incorrect or late submissions may result in delays in reimbursement or contract action. We usually conduct quarterly or monthly meetings as otherwise scheduled, and it'll be held to discuss program operations and progress. Attendance is mandatory and not subject to reimbursement. Next slide, please. The respondent, if selected, should register with the city's online insurance certificate portal using the designated email registration link provided below. And they should provide a current and valid email address for both the contractor and contractor's insurance agent or provider. The selected respondent is responsible for ensuring the submission of a certificate of insurance through the city's online insurance certificate portal prior to the award of the contract. The respondent selected for contract negotiation and award who fails to fulfill the requirement to register and submit a COI through the city's online insurance certificate portal may be deemed unresponsive, and the city may choose to instead engage a different respondent for the contract negotiation. If they're unable to register and submit a COI through the online insurance certificate portal and instead submits a printed insurance certificate prior to contract award, the city may accept a paper COI provided that it has written justification in explaining that this is in the respondent's good faith efforts to comply with the terms of this section and the reasons why the submission could not be submitted. So you'll see here below the link for registering and submitting your COI. Next slide, please. Application guidance for respondents. So in addition to your proposal, we would ask that you submit your proposed budget using the templates that were provided. Any required documents, including liability insurance, which we just spoke about, board member identification, SAM certificate, certificate of good standing, bylaws and articles of incorporation, your financial statement, IRS determination letters, again, budget forms, City of Chicago compliance acknowledgement, conflict of interest forms, any resumes or job descriptions of the program coordinator, staffing chart, and your food box cost proposal. The term of the contract under this RFP will be from October 1st, this should say 2025, to September 30th, 2028. Based on the needs and availability of funds, the contract performance, you may extend this term for up to 1 year with the extension not to exceed 1 year. Additional funding may be dependent on your performance and availability of funding, and DFSS anticipates funding one delegate agency to be awarded at least $250,000 annually, depending on the size of the proposed program. The contract will operate on a reimbursement basis only, and no advances will be given. The initiative administered by DFSS is through the Older Americans Act federal funding. Consequently, all guidelines and requirements of DFSS, the Illinois Department on Aging, and the Older Americans Act must be met. Additionally, all delegate agencies must comply with a single audit act if applicable. Should a respondent's contract be terminated or relinquished for any reason, DFSS reserves the right to return to the pool of respondents generated from this RFP to select another qualified respondent. Next slide, please. Please note this is a competitive process open to all entities, whether it be nonprofit, for-profit, faith-based, public, or private, all units of government and sister agencies. Respondents may apply as a single agency or in partnership with multiple agencies where one agency serves as the lead for the partnership and other agencies serve as subcontractors of the lead agencies. Subcontracted agencies must demonstrate competence to implement programmatic elements, whereas lead agencies also demonstrate financial strength and ability to comply with all administrative requirements outlined in this RFP. Indirect costs will be capped at 15% unless otherwise indicated by a federally approved indirect cost rate letter. Administrative costs cannot be charged as directly related to the program and must be covered by your indirect costs. And respondents who are current DFS delegates with existing contracts with DFSS who are not in good standing will not be considered. Agencies not eligible, including those that have had a city contract terminated for default, are currently debarred or have been issued a final determination by the city, state, or federal agency for performance of a criminal act, abridgment of human rights, or illegal fraudulent practices. Funding is subject to the availability and appropriation of funds. In addition, respondents should be aware that the city will make payments for services on a reimbursement basis. Payment will be made 30 days after voucher approval, and respondents must be able to proceed with program operations until award notification. Next slide, please. The evaluation process. Each eligible proposal will be evaluated on the strengths of the proposal and responsiveness to the selection criteria. DFSS reserves the right to consult with other city departments during the evaluation process, and successful respondents must be ready to proceed with a proposed program with a reasonable period of time upon contracting. Failure to submit a complete proposal and/or respond to all requirements will cause the proposal to be deemed unresponsive and subject to rejection. The commissioner, upon review of recommended agencies, may reject, deny, or recommend agencies that have applied for grants based on previous performance or area of need, and DFSS reserves the right to ensure that all mandated services are available citywide. Next slide. So now we're going to review the selection criteria, the first of which is community involvement. We will evaluate applications based on these criteria. The respondent should demonstrate a clear understanding of the target population, including any strengths or assets, as well as needs and challenges. The respondent should develop specific capabilities or infrastructure to better serve the intended target population and demonstrate client and community engagement activity that inform service delivery. Finally, the respondent's leadership reflects and/or directly engages with the people of communities that it serves. Next slide, please. Organizational capacity. The respondent identifies adequate essential personnel to devote to the work and describes appropriate staffing patterns and qualifications to in context of the clients to be served, including program staff, program oversight, and management, and has a compelling strategy to fill these positions in a timely manner. The respondent should have adequate systems and processes to support monitoring, expenditures, and fiscal controls. The respondent also should have secure data collection and management practices along with adequate processes for quality assurance and timely data entry. The respondent should demonstrate ability to provide citywide services and provide examples of food delivery to various communities. And the respondent clearly describes its HR policies and hiring practices. Next slide, please. The strength of the proposed program. The respondent should clearly define services to be provided directly through partnerships or linkage agreements with other agencies that are appropriate to addressing needs of and achieving desired outcomes for the target population. The respondent's proposed program is supported by strong national or local evidence base and aligns with best practices for the relevant field. The respondent has an effective and intentional approach to identifying, recruiting, and retaining program clients. The respondent has partnerships or coordinates with other agencies to expand or improve services in a client-centered, comprehensive way. The respondent provides a description of proposed contents of the food box, as well as providing seasonal fresh fruit and vegetable options. And the respondent provides a detailed information on their warehouse space and facility requirements on their food safety and pest control plan. We will also be looking at performance management and outcomes. The respondent should demonstrate evidence of strong past performance against desired outcome goals and performance metrics and/or other notable accomplishments in providing services to the target population. The respondent has experience using data to identify problems in service delivery and inform and improve its services or practices. The respondent has experience disaggregating data to identify and address racial, gendered, abled, or other disparities in program delivery. And when appropriate, DFSS may use prior performance data already collected by DFSS or a relevant intermediary. Finally, we'll be looking at reasonable costs, budget justification, and leverage of funds. We look for the respondent to have fiscal capacity to implement the proposed program prior to reimbursement. They must also be able to leverage other kinds of funding, in-kind contributions, and support the total program and administrative cost. And they must demonstrate reasonable implementation costs and funding requests given the nature of the program proposed. The proposed budget must support the proposed scope of work or work plan. Next slide, please. So the basis of award, in addition to the score on the selection criteria mentioned in the previous slides, we may also consider additional factors to select and ensure systems level needs are met. For example, ability to provide citywide services, the variety of food options, and the ability to serve older adults. DFSS reserves the right to seek clarification of information submitted in the response or application, or request additional information during the evaluation process, and make site visits or require respondents to make an oral presentation to be reviewed by the subcommittee if necessary. And failure to submit this complete proposal or respond to all requirements could cause the proposal to be deemed unresponsive and subject to rejection. One contract will be awarded to one senior food RFP applicant. Selections will not be final until the city and the selected respondent have fully negotiated and executed a contract. The city assumes no liability for costs incurred in responding to this RFP or for costs incurred by the selected respondent in anticipation of a fully executed contract. Receipt of a final application does not commit the department to award or grant pay to any costs incurred in the preparation of this application. Next slide, please. Be sure to attach any reports or studies or other documentation that can show performance towards reaching program goals. Be sure to add resumes for key staff who will be involved overseeing the program. And be sure to attach your organization's budget for this program. Please make sure that all program requirements are addressed. Each eligible proposal will be evaluated on the strengths of the proposal and responsiveness to the selection criteria. DFSS reserves the right to consult with other city departments during the evaluation process, and successful respondents must be ready to proceed with the proposed program within a reasonable period of time. Failure to submit a complete proposal or fully respond to all requirements may make your submission subject to rejection. And then the commissioner, I think this was mentioned before, is able to recommend, reject, deny, or recommend agencies that have applied. We reserve a right to ensure that all mandated services are available citywide and provided in a linguistically and culturally appropriate manner. So what does the timeline look like? So we are doing the pre-proposed webinar today, Friday, July 18th, 2025, and it started at 10 a.m. And the due date to submit any questions regarding this webinar or anything in the application is July 22nd. That would be Tuesday, 2025, by end of business day. Applications will be due August 8th, 2025, and the program period is scheduled to begin October 1st of 2025. Next slide, please. The term of the contract is October 1st, 2025 through September 30th, 2028, and the amount is $250,000. Administrative cap of the program is 15%. There is no match requirement for the program. Please submit a budget for 1 year, 12 months of services. Cost category definitions for the budget instructions are in every RFP. And be thoughtful and inclusive when developing your budget. Apply for your program's actual costs. Generally, we can't give you more money than what you ask. And use the reasonable costs question on the application to discuss how you determine the costs reflected in your budget. Common mistakes we see in budgets. Please check your fringe if you include that. Please check calculations. Supplies, often these can be under budgeted or over budgeted for. Making sure that, if there is client assistance, that it is an appropriate and allowable cost. Make sure your job description titles and job description uploads are the same title. Put your budget in the appropriate column and show your match. Again, as a reminder, all applications will be due August 8th, 2025 at 12 p.m. noon Central Time. So I'm going to hand it over to Jillian. Thank you.
Thank you, Stacy. At this time, before we delve into application tips, it's going to pause for a couple seconds for any questions. We will pause again towards the end of the presentation. I do see that we don't have any questions in the chat, so I will move forward with our application tips. And the first tip and most important tip that we can provide is to start your application as early as possible and save it as you go along, as often as possible. And if you have never done business with the City of Chicago, please register into iSupplier as soon as possible. Review the RFP narrative and application questions closely. Remember that they align with the scope and selection criteria. Please use the information in the RFP for guidance in formulating your answers. There is a 4,000 character limit in iSupplier, which includes punctuation and spaces. Each response is allotted 4,000 characters. Please try not to use the back button on your browser. You could potentially lose your work. And again, the most important application tip that we can provide is to start as early as you can. Start your application as early as you can. Some tips for working in e-procurement. To submit multiple applications for a single RFP, applicants will need to set up a unique user account in iSupplier. The e-procurement system is not capable of submitting more than one distinct proposal per associated email address. Therefore, you must use a separate email address for each submission. You can submit your application and later amend it up until the due date of August 8th, 2025 at 12 noon. Avoid the rush and possible mishaps by submitting early, and plan on your submission taking approximately 30 to 60 minutes. Please be advised that late applications cannot be accepted. For assistance, please make use of the e-procurement hotline at 312-744-4357, and they also can be reached via email at customersupport@cityofchicago.org. The hotline operates during business hours only, which is Monday through Friday, 9 a.m. to 5 p.m. Again, we can't stress it enough. Please try to start your application as early as possible to get ahead of any possible mishaps. New agency requirements. We require agencies to provide articles of incorporation and any amended articles of incorporation. We also require an IRS affirmation letter, and that letter is for not-for-profit agencies only. The affirmation letter must be dated within 60 days of your submission. You can obtain this letter by calling the IRS directly at 1-877-829-5500. However, if you are a for-profit agency, submit your original letter from the IRS showing your FEIN number. Your UEI number is required in addition to the Central Contractor Registration, also known as CCR. Provide a copy of the entity overview page on the sam.gov website. And lastly, certificate of good standing letter with the state of Illinois is required. As of April of last year, we have a new labor peace agreement ordinance, which will apply to all DFSS and CDPH delegates that have 20 or more employees working for their organization. The only exemptions are hospitals. Contractor must provide written notice to the commissioner or her designee within 72 hours of becoming aware that employees want to organize or that a union seeks to represent employees. Contractor must enter into the LPA within 90 days of receiving that notice. What is an LPA? A labor peace agreement is an agreement between an employer and a labor union that ensures that an organizing drive is not impacted by union busting techniques, including employee retaliation. And in return, they will not strike or stop work in a way that will impact human services. For technical assistance, On the DFSS webpage, there will be a link to the RFP as well as training documents. Please see the alert section on our website. For questions on registration and e-procurement technical assistance for delegate agencies, again, please contact customer support at cityofchicago.org, and they also can be reached at the help desk. That number is 312-744-4357. We also have training materials, which includes documents and videos on our website, and those can be found at the cityofchicago.org website under online training materials. At this time, we're going to delve into how to enter any responses and accepting the amendment. Step one, you select Create Quote from the drop-down menu in the Actions box and then click Go. And this will take you to the application page where you can get started. If the RFP you are interested in has been amended, you will need to acknowledge and accept the amendment to start and submit your response. To accept the amendment, click on View Amendment History. To begin the acceptance and acknowledgement process, follow these steps after clicking View Amendment History. First, you click on the document number. Next, click on the infinity or eyeglass icon to review the amended changes to the RFP. And lastly, you click on Acknowledge Amendments button to acknowledge receipt and understanding of the changes to proceed. And by acknowledging the amendment, you are indicating that you are aware of the changes made to the RFP in the amendment. When you get to this screen, please click on the I accept checkbox and then click on Acknowledge. Next, you click on Yes to indicate that you confirm your receipt of the amendment. Finally, click on the checkbox that you accept terms and conditions and then click on Accept to accept the terms and conditions. And that is the final step in acknowledging and accepting the amendment. Once you accept the amendment, you can move forward with submitting your application, which we'll go into now. So when you are ready to submit your application, meaning that you've filled all required fields, you've attached all of your required documents, everything that was requested, you start by saving your draft one last time and then you click Continue. Once you click Continue and you receive an error message from iSupplier, it likely means that you are missing information. So I think that this error message is helpful that iSupplier has this function because it will let you know when something is undone. So in the last example, the error message indicated that the lines found under the Lines tab had not been completed. In this example, the error is about an unanswered question in the application or the requirement section. The quote value refers to your, in this case, missing answer. Once your application is free from errors, you are ready to proceed and submit. And at this point, clicking Continue should push your application into the review and submit phase. Once you see this screen, this is like a summary page, and this is also your last chance to review all of your data and confirm that everything is accurate. Please go through it one more time to check your attachments and scroll to the bottom of the screen to see all of your responses. And at the bottom of the screen, you'll be asked to provide an electronic signature. Please be sure to fill in that signature box before checking the box. Once you check the box, you are finally ready to submit. So you scroll all the way down to the bottom of the screen and submit where you see where it's highlighted. Once your application is submitted, you will receive a submission confirmation screen. The e-procurement system will also send an confirmation email from e-procurement within 24 hours of your submission. However, if you need just that, if you want to like make sure that it's submitted and you want that extra confirmation, you can call or email me. My name is Jillian Black. Again, my email is jillian.black@cityofchicago.org. And at this time, we're going to pause again for questions. And I do see that we have 4 questions in the chat. We can start with the first one. It says, where to get the food?
So it would be the responsibility of the respondent to, be able to procure the food and provide that. So that would be, what the delegate agency would be responsible for securing.
Thank you. And the next question we have is, are these boxed individually for each recipient, or are we delivering items in bulk to the senior center to pack?
It would still be boxed individually and then delivered. It's a bulk delivery, but each package is packaged individually because the senior center recipient would be picking that box up to take home.
Thank you. Our next question is, the food is delivered to one of the 6 centers to the customer's home?
The food will be delivered to all 6 regional senior centers throughout the city of Chicago. In the past, we have delivered to the customer's home, but currently, as it stands, this contract is for the senior center deliveries.
Thank you. And the last question I see is, where is the page to price out the program, and how many pounds of meat should we base it off of?
So there's a cost proposal that is provided. I think it is in one of the documents that were sent over, Jillian. So, the total cost of the award is $250,000. And so that's what we're seeking, is for the delegate to provide that cost proposal, considering the number of clients we are projecting to serve as well.
Thank you. We have a couple more questions. It says, how do we collect contributions if we deliver monthly? Do we provide a contribution box?
Some providers do this different ways. So I think we can get back for more guidance. I know, for example, like the home delivered meal program provides like envelopes to participants that are returned. There wouldn't necessarily be a box, but we can certainly work with the selected delegate agency as far as how we can do that.
And our last question at this time is, are the special packaging requirements for meats versus produce?
We do want to offer both a meat and a vegetarian option. And I know Veronica talked a little bit about, vegan options as well. And so not necessarily packaging requirements, but there should be a distinction, between the boxes.
Thank you. We do have 2 additional questions that just came in. It says, apologies, I may have missed it, but how many clients is this project intending to serve?
I think we said about 1,000 clients. I have to look back on the slides. Let me see. We can get back to you. I'll look back on the slides, but I believe it was 1,000 clients.
Next question is, what community outreach materials will be provided by DFSS versus what types of materials will need to be created by the agency?
So DFSS typically has created flyers. We've distributed in our Senior Connected brochure, social media, but in the past, delegate agencies have also created their own flyers, for example, to be distributed. And so that is subject to DFSS approval by our public information officer.
Thank you. Next question is, can we use donated food?
In the past, we also have used donated food, yes.
Okay. And one last question we have is, one time per month deliveries but how many meals per box or meals per person?
So we said monthly or quarterly deliveries, depending on funding availability. And it would be, enough meal, again, that's part of your cost proposal, how much food you'll be including. These aren't meals, these are, grocery items, right? And so it would kind of depend on what the participant or what the selected respondent proposes in terms of contents in the box.
One last question that just came in is there a requirement for specific food or volume of food and amount?
So we do, again, as mentioned, want fresh produce, frozen meat options included as well, and shelf-stable items. But the focus would be the frozen meat and the fresh produce.
Okay, thank you. That is all the questions that are in the chat at this time. We do, you do still have time to ask questions. I believe the question deadline is July 22nd, which is Tuesday. And those questions can be sent to Stacy Sabita. Her information, contact information is listed on the screen. And any non-programmatic questions, so if you're having difficulties and technical issues with e-procurement in the iSupplier system, you can send those questions and to customer support at cityofchicago.org. You can also call to speak with someone at e-procurement. The hotline is 312-744-4357. Again, their hours are Monday through Friday, 9 a.m. to 5 p.m. And you can also send questions to me. Again, my information is jillian.black@cityofchicago.org.
Jillian, just to clarify, the number of clients we're looking to serve is between 600 to 1,000 clients.
Okay, thank you.
And then I think there was one more question.
Yes, I do see two more questions just came in. Can you clarify whether an agency is to provide boxes to all senior centers with each delivery?
That's correct. So the boxes would be delivered to all 6 regional senior centers throughout the city of Chicago.
And one last question is, what is the selection criteria?
So the selection criteria was reviewed in the slide. Again, we'll have a recording of the slides available, but they were listed, I think, on slides. Try to get that exactly for you. Slides 42 to slides 50. 42 to slides 48.
Thank you. And that information can also be found in the RFP, I'm sure, right?
Yes.
Okay. At this time, we will I will give the floor to Senior for any last remarks before we close out.
Thank you, Jillian. So again, thank you all for taking the time this morning to attend the webinar on the Senior Food Box Program. We are looking forward to any questions. Again, the due date for that would be end of business day on Tuesday, July 22nd. And again, the deadline to submit your application would be August 8th at 12 p.m. noon. So again, thank you so much for joining us this morning.
Thank you, everyone. Good luck on your applications and enjoy the rest of your day. Thank you.
Thank you.